Hello everyone, my name is Muse Prasad, and today I'm presenting the design of a CRISPR-Cas9 therapy to target a 4-base pair insertion in Tay-Sachs disease. Tay-Sachs disease is an autosomal recessive disease. This means that people can be carriers, but it's only manifested when 2 copies are present in a person. There are multiple mutations that are correlated with Tay-Sachs disease, but the one I'm focusing on today is a mutation of the hexA gene on chromosome 15. The mutation of the hexA gene results in a mutation of hexA enzyme. This enzyme regulates GM2 ganglioside buildup, and once that buildup does happen, various effects happen depending on what age range the patient is in. This disease can be classified as a lysosomal storage disorder that affects the central nervous system. So a lysosomal storage disorder is the cost of that GM2 ganglioside buildup. I've included this image because it's great at showing a key characteristic that doctors use to identify Tay-Sachs disease patients. We see a normal retina at the top, but at the bottom it's another image of a retina, but this one has a cherry red spot in the macula. That's a key characteristic that is a result of swollen neurons from GM2 ganglioside buildup. Not only does that happen, but neuronal degeneration does happen when we have this ganglioside buildup that I will cover in further slides. So Tay-Sachs disease results in a quality of life degradation across any age range it exists in. It's most common and most lethal in infantile patients, with the result being death by the age of 3, along with neurodegeneration and delayed or non-existent neurodevelopment. The next is juvenile. It does result in delayed development and a lower quality of life, but death is not as common as in infantile. And the last one is in adulthood. In this one, symptoms range very drastically. Sometimes people lose the ability to walk, and sometimes they lose overall neural degradation, or sometimes they have overall neural degradation. It just depends on the patient, and it's a case-by-case situation with adulthood patients. Tay-Sachs disease is present in all ethnic backgrounds, but it's most common in the Ashkenazi Jewish population. It's about 1 in every 40,000 people for ethnic backgrounds outside of the Ashkenazi Jewish population, but within that population, it's 1 in every 3,500, with 1 in every 29 people in the Ashkenazi Jewish population being a carrier. This is also how I helped narrow down what mutation I was focusing on, because I want to look for the most prevalent one correlated with Tay-Sachs disease within this population. So there are nearly 130 mutations identified that correlate to Tay-Sachs disease. It's not sure whether they are a causation directly. However, they only exist within a specific family's lineage, which is how I made that connection to the mutation I'm going to talk about. So there are 3 mutations that are common among carriers within the Ashkenazi Jewish population, and out of the 3, a GATA insert in the hexA gene on chromosome 15 is the most common and the focus of this project. As previously stated, the most common mutation is an insertion of a GATA 4 base pair on the hexA gene. The result is a frame shift that results in early termination of transcription. Due to this, it leads to an almost undetectable amount of hexA mRNA and theorized to lead to an inactive form of hexA enzyme. So right here we have the enzyme that helps break down GM2 gangliosides. So we have the alpha subunit and the beta subunit. The hexA gene controls the formation and folding of the hexA alpha subunit on the left. So what happens in Tay-Sachs disease is that the alpha subunit on the left gets misfolded, it can't function properly, and then we get that buildup of GM2 gangliosides. Before I continued, I wanted to cover what a GM2 ganglioside is. It's a salicylic acid that's stored in the lysosome that helps support a cell through transportation from parts of the plasma membrane. It does help in communication and modulation of ion and protein concentrations also. This buildup, like I said, causes neuronal death, and over time, without this hexA enzyme at play, will result in neurodegeneration and death. So there are symptomatic therapeutic options available because in a lot of cases you do need palliative care for this disease. These encompass medications, occupational therapy, physical therapy, and a specialized diet. It also depends on what age range the disease manifests at that these options are available to a patient. However, none of these are curative of the actual problem at hand, and it's very difficult to experience this disease with no specific treatment for it other than making it easier or making your life easier in some way that doesn't actually target the problem. And the focus of this presentation is to go ahead and find a way to target the problem. That way we have a more long-term, long-lasting solution. So there are a couple of corrective therapeutic options at play that are in clinical trials and used in other methods, whether it's a cell line for right now. And these are bone marrow transplant, enzyme replacement therapy, chaperone therapy, gene therapy, and substrate reduction therapy. And I will go over um, all of these more in depth in the future. So the first one I want to cover is a bone marrow transplant. So before we really get into this, I need to define some things for you. So HSCT stands for hematopoietic stem cell transplantation. This data shown right here was a case study done in a 23-year-old male who was diagnosed with Tay-Sachs disease at 14 years old. So he's a juvenile case. The bottom graph part for the x-axis, GA2, LC3, and GM2 are beta-hexamidase enzyme substrates in circulation. They're related to and are indicative of hexa enzyme levels. So this data was taken basically post 8 years after transplant to see how long and how well the transplant was helping the patient. The evidence was there. The evidence suggests that neurodegeneration was arrested and that this method could be a successful treatment. However, this method is expensive, and there was only a handful of cases of this working in late onset Tay-Sachs disease and not really infantile Tay-Sachs disease, which totally secludes a population that definitely needs help due to infantile Tay-Sachs disease having the highest death rate also. So on this slide, it focuses on enzyme replacement therapy, which is the concept of replacing missing enzyme in doses to make up for the lack of enzyme present in the body. So from this, researchers generated 2 patient-derived iPSCs to test enzyme replacement therapy on. A Nile red assay was used to look at lipid accumulation, and an overall improvement was seen in iPSC cells. In previous clinical trials used on patients, there was no improvement seen due to a lack of enzyme replacement therapy that was actually able to reach neuronal cells. So this is a case of where we do have a method that can be used in vitro, but won't actually work in a patient's body due to other circumstances at play. Can enzyme replacement therapy be a future option? Yes. However, it's expensive. You need repeated doses. It might be super specialized, so it might be hard to get patients there. And right now we're having trouble with delivery. So it's not a great option to use in terms of treatment for Tay-Sachs disease right now. In chaperone therapy, it uses small cells that inhibit target enzymes, and it helps to stabilize the native protein structure. That way, the desired outcome is that an enzyme achieves correct folding, allowing it to be functional. In the figures to the left, pyrimethamine was used on mutated cell lines to express Tay-Sachs disease to determine the efficacy of it improving relative hexa enzyme activity. And we do see that there is a relative increase across the board. In the figure to the right, researchers actually used that same pyrimethamine study, which is a malarial drug, and measured it in actual patients. The major side effect of this is that there is a folic acid deficiency, so patients were also administered that folic acid. Out of the 10 patients admitted, only 8 started the trial. So from the beginning, only 8 were actually in it, even though 10 met the criteria, and only 1 finished it from those 8. Everyone else dropped out by the 75 milligram dose due to severe side effects from the medication. This is one of the only cases of chaperone therapy being used in Tay-Sachs disease. We see it just wasn't a great outcome, and this is not at all an option at this point in time. So in substrate reduction therapy, the aim is to reduce the rate at which a material is made. So in the case of Tay-Sachs disease, this treatment offers to reduce the amount of GM2 gangliosides produced in the body, allowing that lower amount of hexa enzyme that does still work in a Tay-Sachs patient to actually work at an efficient concentration level because there's less GM2 gangliosides. So in this study, the substrate reduction enzyme was done to 3 patients with juvenile Tay-Sachs disease. by increasing the concentration of megalostat. It's an inhibitor of glucosylceramide synthase. So basically, by inhibiting megalostat, it inhibits the creation of a GM2 ganglioside building up so fast. In Figure A, it measures verbal IQ. In Figure B, it measures performance IQ. In Figure C, it measures a working memory composite that basically is reflecting a child's ability to recall, manipulate, and sequence auditory information. And then in Figure D, it evaluates phonological abilities as a prerequisite to reading fluency. We see across the board that there's not really too much of an increase. In fact, in Figure D, we actually see a drastic decrease. Figure B, it bounces around for the second patient, and just all around, there's just not a great outcome of using substrate reduction therapy as a method of treating Tay-Sachs disease for right now. So this leads me to gene editing, which is what this project is focusing on. It's the only corrective method that offers a solution to degeneration. The cost for patients is relatively cheaper compared to alternative methods, and it's a more permanent solution. With this in mind, it can be delivered across all age ranges, so it doesn't just seclude out one age range. So let's talk about this further. When talking about gene editing, there's a couple of different tools that can be used. In my case, I'm using CRISPR-Cas9. This stands for Clustered Regularly Interspaced Short Palindromic Repeats. It's a system that utilizes an RNA-guided endonuclease, Cas9, to make specific cuts in sequences. Normally, this results in a double-strand break, and depending on the method used, the body can then repair and introduces a mutation that could disrupt the disease if that's the desired outcome. There's a couple modifications that can happen that we'll talk about in future slides. So what I'm using specifically is called CRISPR-Cas9 nickase. So CRISPR-Cas9 nickase is a mutated form used to create a precise single-strand cut, cleaving only one target strand. So that means I can then use two Cas9 nickase systems designed for different strand recognition and make staggered cuts, therefore having fewer off-target consequences and a more precise cut for what I need. So after CRISPR-Cas9 nickase cuts a single DNA strand, I'm not just letting the body repair itself. I'm using something called homology-directed repair. It's a method of introducing a desired insert to the breakage site. The efficacy of it rapidly declines when further than 10 base pairs from the cut site to the mutation. I do end up having a problem with this in my project that we'll talk about later. But with this, then how the goal of me using that is that I insert what I need to then reduce that frameshift mutation to a normal functioning gene. So, like I said earlier, you need a guide RNA. These are my guide RNAs, but the big thing with needing a guide RNA is that you need something called a PAM. A PAM stands for protospacer adjacent motif and is a short DNA sequence that follows a DNA region that allows for targeting and cleavage by nickase. There are certain specific PAM systems. The PAM system I chose based itself off triplets of a NGG codon triplet. So we see for the forward strand I have AGG. So basically I was looking for specific PAMs around my mutation. With that in mind, I ended up creating one forward strand and two reverse strands as a guide RNA for nickase to target and cut at. So after designing my guide RNAs, I had to test the thermodynamics on them. This is looking at GC content, melting temperatures, possible hairpins, and possible heterodimers that can form. The thermodynamics of my design strands have pretty good GC content due to them being not too high. When they are too high, it gives a risk of stronger hairpins. If it's too low, it causes a lowering melting temperature, leading in both situations to just become ineffective within the human body. The hairpin is an attribute that is needed to be analyzed because the strand is always at risk of annealing to itself, leading the treatment with no deployable use. In all cases, although we do see hairpins happening, the melting temp of these hairpins are all lower than human body temperature, meaning that it's highly likely that it can exist. In the hetero part, we see that the spontaneity of a heterodimer could possibly happen, but it's not guaranteed either. So now this leads me to my off-targets. BLAT is a sequence alignment algorithm used to identify sequences with a 95% or greater similarity. This is a way that can be used to find off-targets for a designated strand. The reason we need to find our off-targets is because if we decided to deploy this treatment to the human body and it cuts the wrong site, it could lead to very negative consequences that we don't want. In my case, my only similarity was for my desired sequence on chromosome 15 for the hexate gene. More off-target analysis can be done in a more complex scope, but for the scope of this project, it did show pretty good efficacy. So in my homology-directed repair design for my forward strand, my reverse strand, I have both of them listed here, with the forward being 5' to 3' and the reverse being 3' to 5'. My insertion for my forward strand is 71 nucleotides away, and like I said, you don't really want it to be more than 10 nucleotides away, so that does show some potential problems. My reverse can be either 17 or 41 nucleotides away. The 17 is actually pretty good. The reason there's 2 is because, remember, I have 2 reverse guide RNAs that could cut at 2 different sites. The double-stranded DNA plasmid would have to hold anywhere from 140 nucleotides to 164 nucleotides, which are not at all pushing it to its capacity when we talk about delivery into the body. So the overall conclusion to this is that gene editing does offer the best method to treat Tay-Sachs disease right now. That doesn't mean other methods can't make advances and potentially lower costs, make treatment easier, actually hit delivery sites, all of that stuff. It's just gene editing already has the peripheries almost already there. It's just designing a project and then testing through the needed methods to get there. In my specific case, thermodynamics of the potential sequences are not ideal. You would like perhaps a little bit lower GC content, not so many base pairs when they're hairpin, potentially no hairpins. Off targets definitely need more analysis, although my BLAT analysis did show no matches. More complex methods can be used. The HDR would definitely have low efficacy due to the forward strand having 71 nucleotides away when we don't want anything much more than 10 away. The next step would probably be to use a different CRISPR-Cas9 mutant to utilize a different PAM sequence and potentially find more ideal cut sites to then deliver the HDR to. Lastly, I would like to give a special thanks to Dr. Southwell and Jen Aquino for all the help in building the knowledge towards this foundational understanding and practice that is used to conduct these projects using these specific tools and methods. It's honestly not an opportunity many of us get within the biomedical sciences, and I will forever be grateful towards this experience because it's honestly shaped a lot of where my interests have went since this class. Thank you so much, guys.